something that deals with the inner self, a person's philosophy, a person's determination to decide what is right and then have the guts to do what is right. In other words, those nasty glances or those little racial slurs and whatnot, I tuned them out, paid them no mind, because I was focused and fixed on trying to get what I call a job done.
A bold stance by Dr. Andrew Best during the 1950s led to lasting changes across Eastern North Carolina.
The segregation era is one of those things that you look at and you can't imagine nowadays.
I can't imagine what it took to be willing to endure all the conversations and challenges that go along with breaking the mold of history.
It takes a really strong person to move into that environment. That's the genius of Dr. Best.
At his core, Dr. Best wanted to serve people. After growing up in Lenoir County, Best went on to school at North Carolina A&T. He was in the ROTC program there. In 1943, he was then called to serve our country in World War II. He spent time in Italy.
So this would be sort of day-to-day diary. Some days were more exciting than others if a fellow soldier needed stitches.
And then returned to the States when the war ended, earning a Purple Heart and a Bronze Star along the way.
People say that word service. There are a few people who it really does define how they've chosen to live out their career.
But his desire to serve didn't stop there. Best received his Doctor of Medicine degree at Meharry Medical College in Tennessee, and then in 1954, he found his way to Greenville.
From day one in my office, I didn't come to practice minority or black medicine or Negro medicine, but I came to practice medicine, period.
After opening his own practice as one of the only black doctors in the area, he then started providing care in a segregated Pitt County Memorial Hospital.
All of the black folk were admitted on one wing. I don't care whether you had a newborn baby or whether you had the pneumonia, you all down there jumped up together.
He fought for equal access for all.
I was very happy that we got them to agree to admit patients on the basis of their disease process, not on the basis of the color of their skin.
His service didn't stop in the hospital.
My involvement in community affairs was just as important as my involvement in medicine.
He served on many boards, one being the UNC Board of Governors, where he lobbied to start a medical school at East Carolina University.
He worked long and hard and tirelessly with Dr. Jenkins and others in the community to talk about it wasn't just African Americans who weren't getting health care out here, it was everybody. He and the coalition got together, lobbied the state and said, we need a medical school out here. We need to produce physicians here because you're more likely to stay here if you're produced here.
His legacy still lives on at the Brody School of Medicine. Each year, they host an Andrew Best banquet for graduating medical students.
That lineage and legacy is very strong at ECU and at the Brody School of Medicine. That dinner is symbolic of all that he did here. And we continue to meet people who are inspired by that legacy, want to come to Brody, want to stay here, want to practice here, and make a big difference.
The legacy also lives on through his work at Pitt Memorial, which is now ECU Health.
Back then we had a hospital that was a small county hospital, segregated. Today we have one of the nation's largest academic medical centers, and all of that is a testament to people just like Dr. Best.
While Best made a huge impact decades ago, Eastern North Carolinians are still feeling the effects today.
I do think that we are way healthier because of people like Dr. Best, and that is not to say we don't have a lot of room to go. But when you look at the pivotal time that he lived in, he has put in place not only hospital care, but physicians through his advocacy of getting a medical school here, and physicians who stay in rural Eastern North Carolina. That has had a tremendous impact